much do you know about iron? Let's find out through this video. Iron is an essential component of hemoglobin, an erythrocyte or red blood cell protein that transfers oxygen from the lungs to the tissues. Iron also contains myoglobin, another protein that provides oxygen. Iron supports muscle metabolism and healthy connective tissue. Other components are necessary minerals for physical growth, neurological development, cellular functioning, and synthesis of some hormones. Dietary iron has two main forms, heme and non-heme. You can find heme iron in lean meat and seafood, and non-heme iron in nuts, beans, vegetables, and fortified grain products. In the United States, about half of dietary iron comes from bread, cereal, and other grain products. You can also get your daily iron needs with supplements include ferrous and ferric iron salts such as ferrous sulfate, ferrous gluconate, ferric citrate, and ferric sulfate. And the other forms of supplemental iron such as heme iron polypeptides, carbonyl iron, iron amino acid chelates, and polysaccharide iron complexes.
The average recommendation for daily iron intake by age is for children to up to 11 years old is 11.5 to 13.7 milligram per day. For children 12 to 19 years old is 15.1 milligram per day. For men over 19 years old is 16.3 to 18.2 milligram per day. For women over 19 years old is 12.6 to 13.5 milligram per day. And then what happens if iron levels in the body are depleted? If iron levels in the body at mild deficiency stage, it causing serum ferritin concentrations and levels of iron in bone marrow decrease. And then if iron levels in the body at marginal deficiency stage, it causing iron stores are depleted, iron supply to erythropoietic cells and transparent saturations decline, but hemoglobin levels are usually within the normal range. And if iron levels in the body at iron deficiency anemia stage, it causing iron stores are exhausted, hematocrit and levels of hemoglobin decline, and it resulting microcytic hypochromic anemia. Microcytic hypochromic anemia is characterized by small red blood cells with low hemoglobin concentrations.
Are you at the group at risk of iron deficiency? Take a look at this group. In pregnant women, low intakes can increase her infant's risk of low birth weight, premature birth, low iron stores, and impaired cognitive and behavioral development. In infants and young children, iron deficiency can lead to adverse cognitive and psychological effects, including delayed attention and social withdrawal, and also can increase the risk of neurotoxicity. In women with heavy menstrual bleeding or menorrhagia, having significantly more iron per menstrual cycle can increase risk of iron deficiency. Infrequent blood donor and cancer, probably due to chronic blood loss. In people who have gastrointestinal disorder or have had gastrointestinal surgery because their surgery requires dietary restriction or result in iron malabsorption or blood loss in the gastrointestinal tract. In people with heart failure, potential causes of this iron deficiency include poor nutrition, malabsorption, defective mobilization of iron stores, cardiac cachexia, and use of aspirin and oral anticoagulants, which might result in the loss of some blood in the gastrointestinal tract. Do high dose of iron supplement have an effect on the body? Of course, yes. Supplement containing 25 mg iron or more can reduce zinc absorption and plasma zinc concentration. High-dose iron supplement can also cause gastrointestinal effects, including gastric upset, constipation, nausea, abdominal pain, vomiting, and diarrhea. Acute intake of more than 20 mg per kilogram iron from supplement or medicine can lead to corrosive necrosis of the intestine, which might lead to fluid and blood loss, shock, tissue damage, and organ failure.